Good morning and welcome. Great to see you all. So I'm Paul Sweeting and I'm the Sussex-wide strategic lead for the Sussex VCSE Leaders Alliance. I appreciate that some of you may not have heard of our alliance. And essentially, it's our job to help bring the voluntary, community and social enterprise sector together with the health and care sector to work together in partnership to improve health outcomes and tackle health inequalities for our population. And we'll be emailing you out after the webinar with further details about the Alliance and how you can get involved. The development of integrated care teams across Sussex is a key example of how we need to make this partnership work in practice. Before we get to our speakers, I just need to do a bit of housekeeping. We are recording this session, and secondly, firstly, please keep your microphones muted. It's a short webinar. We won't have time to facilitate a formal question and answer session at the end. But if you have comments or queries, please feel free to post in the chat. We can't promise an instant response, but we'll review everything that's posted. And just to reassure you, we're at the beginning of a 5-year programme of development, and there'll be many more opportunities to engage with this work. So over to our first speaker. Please welcome Paul Wilson, Director of Strategy and Integration, NHS Sussex. Paul is going to talk through an overview of the Integrated Communities Teams programme in Sussex. So over to you, Paul.
Thanks, Paul. Really grateful to be here, and thanks for the opportunity to speak to you all today regarding our development programme associated with integrated community teams. As Paul said, I'm the Director of the Strategy Integration for the Integrated Care Board, and I'm joined by various colleagues today to talk to you about integrated community teams. The purpose of today's session is to provide you with a very brief overview of the latest developments associated with our ICTs. A bit of specific work from our places around the development that's happening within those areas, and probably most importantly, some further information with how best you can all engage with the work that's happening in terms of the development in those areas as well. Sorry. So I'll begin by giving an overview of the journey so far with respect to our ICTs that some of you might be familiar with from our last webinar. Do you want to go to the next slide, please? So we're all aware of the current challenges that health and care currently face, I think, and this has really provided a bit of a rationale in terms of the case for change as to why we've decided to focus on the development of integrated community teams. Some of the reasons why the health and care system is not effectively meeting those challenges is outlined below. In essence, those are how services are arranged and organised is often disjointed. We don't focus enough on prevention as a system, and we don't always make the best use of digital. And within that, we're obviously all facing financial and resourcing challenges in terms of what we'd like to do and making that money go further and getting the best value from it. Next slide, please. So integrated community and teams are in part a response to those challenges within the health and care system. And these are set out in terms of our aspiration and vision within our strategy, which is called Improving Lives Together, which is outlined here. It is a 5-year strategy. So as Paul has outlined, we are at the very start of this journey. So there's a real opportunity for partners to get engaged with the work that's happening. So we're effectively at year 2, and I'll talk through some of the things that we've achieved so far, but we are at the very start. So lots of opportunity to engage. In essence, ICTs are a vehicle for the integration of healthcare and voluntary sector services within a defined geographical area. And our intent is that within each of those ICT footprints, we will give a core offer which will be delivered within the ICT that is consistent. I'll talk a bit more about the core offer shortly, but it's basically our health and care model in response to the various population needs within our ICT geographies. And that will take a keen focus around addressing health inequalities, preventative care, and also taking proactive care for the complex patients within those ICT footprints. Next slide, please. So what have we achieved so far in terms of our journey? We've just come out of the first year in terms of our ICT development programme, and these are some of our key highlights in terms of the work that's happened across Sussex. Now, we've worked to define the footprints for our ICTs, so the geographies in which our ICTs will work and function, and these are broadly kind of coterminous or aligned with the boundaries of the district and boroughs across Sussex. Within each of those ICT footprints, we've developed community data profiles and insight packs that will act as the focus for how ICTs focus their activity to look at what needs and inequalities needs to be addressed within each of those footprints, and probably most importantly, to hear the voices of those communities that those ICTs will be looking to serve. We've also built upon the work that has happened across our 3 frontrunner programmes that you might have heard of across Crawley, East Brighton and Hastings, and my colleagues on the call will talk in a bit more detail about that when it comes to their presentation. So, and finally, we've done some further work around looking at what our core offer is in terms of what will be delivered within those ICT footprints. Next slide, please. In terms of those footprints, we've basically used some key principles to inform the establishment of those ICTs. So recognising that there are existing relationships that are focused on partnerships within those geographies, that we need to ensure appropriate alignment with local authorities, and that forms part of the rationale for our ICT footprints. And also in terms of the data and how we can choose to make comparisons in terms of the population outcomes, all form the basis for why we've chosen the geographies that we have done in terms of our ICT footprints. Next slide, please. This is a bit more information around the data and insight profiles, and an example of how the information is displayed within the profiles is illustrated on the right-hand side. These have been key to informing how ICTs prioritise the work and where we should be addressing and focusing our attention in terms of those ICT footprints. We'll also share, as a follow-up from the meeting, the link to all of the 16 community insight profile, because there's a lot of information and data and voices to be heard in terms of those community profiles. So we'll send a link around post the meeting for you to dip into and have a look at the kind of information, but they are a really rich data source in terms of informing and helping us to prioritise the work of our integrated community teams. Next slide, please. These are kind of the core principles. So we've been working across partners, across health, care and the voluntary sector in terms of our ICT development. And we felt it's important to have a kind of solid foundational basis on which ICTs will be developed and formed. I won't go through these in detail, but hopefully you'll recognise some of the key themes in relation to this, including kind of care, the importance of care coordination, person-centred care, supported health, self-management, and using the assets that we have in each of our footprints as the basis for our integrated community teams. Next slide, please. So this slide provides a bit of an outline of how we've developed the core offer. It's based on the pyramid of population need, whereby the health and care needs of our population across Sussex can be divided into various levels of differing health and care response in relation to that need. And in relation to ICTs, we've chosen to focus our attention around the top and bottom of the pyramid. So developing both a proactive and preventative core offer to those portions of the pyramid. And I'll explain a bit about those offers in terms of the next slide. So this illustrates the kind of foundational basis of the core offer in terms of a preventative and a proactive care offer that will be delivered via the vehicle of our integrated community teams. and it gives you an idea of the kind of outcomes we're seeking to achieve in the development of that model of care within the prevention and within the proactive care space in order to help support, address health inequalities, improve patient outcomes, etc. So hopefully that gives you a bit of an overview of what we're seeking to achieve in relation to the work of our ICTs. Next slide. So what comes next in terms of year 2 of our development programme? So I've just given a really high level outline of where our focus of attention will be in year 2. So we're focusing the development work around our ICT footprints to be place-led. So within the places of Brighton, Hove, East Sussex and West Sussex is where the development and the engagement will happen, which is why I'm really keen that you hear from my other colleagues on the call, because that's the real opportunity in terms of engaging with the work. As part of that, we need to better understand the community assets, services and leadership within each of our ICT areas, because they really form the foundation of coming together in terms of integrated community teams. We're also doing some further design work on the shape of the core offer and what that means in terms of a model of care and how services can be wrapped around our patient and population to deliver that core offer. And in terms of the preventative offer, we're working with our colleagues in public health in terms of the shape of what that might look like and how that could be consistently applied within our integrated community teams. And finally, to enable all of this work to happen, we need to think about how we use particularly our teams across the digital and workforce spheres in order to support the delivery of our ICTs, because digital integration, for example, will become critical in terms of making this happen and bringing it to fruition. So these are really a bit of a flavour of all of the things that we hope to be achieving within year 2 and engaging with the wider community in terms of the development work that's been taken forward is really critical to that. So I'm really pleased to be able to now kind of hand over to some of our place-based leads to talk you through the more specifics of the work that's being carried forward there. Thanks, Paul.
Thank you, Paul. But before we hand over to our place-based leads, if we can just take down the slide for a second, Penny, we're going to hand over to Jo Martindale. So Jo Martindale is the CEO of the Hangleton and Knoll project, and she's been leading the VCSE engagement in the development of the ICT programme. And so we're going to hear from Jo from her perspective as a kind of a community and voluntary sector organisation CEO. What does it mean for this sector? How can we get involved? Why is it so important? And just a reminder as well, although we're not going to have a formal question and answer session at the end, please do post any questions or queries in the chat. If we don't have time to get back to you today, we are going to be reviewing and everything. And as I said, there'll be plenty more opportunities to get engaged in this work. So over to you, Jo.
Thank you, Paul. And that's great because I don't have to introduce myself, but I'm interested in ICTs, both in my day job as the Chief Exec of the Hangleton and Knoll project, but also in the strategic development in the work that I've been doing with the Leaders Alliance, which obviously takes into account all leaders across the whole of the system, East Sussex, West Sussex and Brighton and Hove. So the ICT delivery board that I sit on, that Paul works to, is Sussex wide, and although it's quite health chaired and health, I hesitate to say dominated, it is very critically a system board that has me on it, that has adult social care on it, and primary care too, alongside health, reflecting the fact that the system is everybody together. So it's been really interesting and useful to have been part of that from the beginning and be able to feed in kind of the role of the VCS and the expertise that we can bring to this programme from the beginning. And I think what's happened is, having set the direction at Sussex level, we've seen a very welcome shift, something that I think particularly the non-health people were super keen on, which is a move from Sussex-led to Sussex Enabled, with much more emphasis on what we as a collaboration of system partners can do at place, which is a bit nearer the ground of ICTs, and builds on the kind of the relationships and collaboration that we need to actually make anything happen. So my involvement over the past year has been the stuff that Paul has shown you, the huge pieces of work around data. And you know, when the link comes out, I do urge you to have a look at your bit, because it's insanely rich. There's so much a detail. But having set that direction, the recognition is that if we're actually going to do anything, implementation needs to happen a lot further down. So I think my understanding, at least, is the case has been made for why we need to be more collaborative and more integrated. No one's arguing that we need to do that, but I think there is still a lot of scope for working out how we do that, and that is the bit that I think we in the VCS are really good at doing. We're good at translating strategy. We're good at partnership. This is a natural sphere for us. So this is the moment in ICT development, I think, where we can really add value and contribute. Paul mentioned that this is a change process over the next 5 years. I mean, in my head, it's probably longer than that. So I do think, I keep saying this, I probably won't be around to see all the benefit and fruit of the work that I've done now, because I think a lot of the opportunities will come years down the line. But the way the system works doesn't change that often. And I think that this is a genuinely an opportunity to get involved at a point where change is happening, and our influence as a sector can make a difference. So there was a point of, why is this of interest to us as a sector? Well, one, we have a mandated role from national to be part of the health and social care system, and as a passionate believer in the work that we do in every way, at voice level for our communities, but also delivery, commissioning, our role has been recognised and we are mandated part of it. And I have been made extremely welcome, and my views have been heard and listened to. So that can mirror through the whole system down to place, and how you can get involved at places, what's coming today. So we support, as a wider sector, community voice, co-production. We focus on prevention. We're really massively interested in health inequality. We deliver, we're agile. All the things that you know about us are things this programme really needs. And that whole population need, it is a shift. That is a shift in the way people are thinking. When you get Paul's slides, have a look at that last outcome slide and look at the fact that whole population health is there with a set of outcomes against it, that almost certainly every CVS person on this call, organisation, will in some way be delivering those outcomes. So that is a very clear slide to show of why it's important for you. And ICTs will need all sizes and types of organisation in order to function. And the hyperlocal, I mean, I don't know if we've got any community groups on the call, but absolutely that they're as relevant as the big organisations that will cross Sussex, that will deliver part of the core offer. So I think it's relevant whichever size of organisation, and all the different sizes in between. You'll note that social prescribing is embedded as an activity and a principle. That's something that the sector has been very involved with, both in terms of delivering it as a service, but also as in terms of feeding people into it and being a pathway out into whatever community activity. You'll notice in the founding principles, asset-based community development. For me, that's very close to my heart, and something that in my rep role I argued for strongly. Person-centred, all the kind of things that we would like to see in the sector, and that are values that we share with our health and social care colleagues. Finally, I think it's important to us about leadership. We have a role in leadership. Leadership doesn't have to come from any one particular place. Within ICTs, I think there will be ICTs where we as a sector can provide that leadership. Certainly that's a role that I'm sharing with clinical colleagues in the west of Brighton and Hove, because we have a lot of the knowledge, networks, relationships and understandings to help this happen. So we need to step up and be in the space. I think that's probably what I wanted to say, but I would just urge people to get involved. This is a big change programme. We're right at the beginning of it. It's the right time. Thanks, Paul.
Thank you so much, Jo. So now we're going to hear the individual updates on the 3 places, and we're going to go in alphabetical order. So we're going to start with a Brighton and Hove update from Chaz Walker, who's the Joint Programme Director for Integrated Service Transformation in that area. So over to you, Chaz.
Hey, thanks, Paul. So nice to be with you all this morning. So yeah, my role, I lead for Brighton and Hove as Programme Director, supporting integrated community team development. So Penny, you're right to go to the next slide. So we just wanted to give you a bit of an idea of how the VCSE in the city is represented in terms of our formal development of integrated community teams. So we have a health and wellbeing board, which is our formal place-based governance for our health and care partnership, which has 2 VCSE reps on that board to ensure that you are fully represented. Supporting that board, we have a partnership executive board. Again, Community Works represent the VCSE on that board. And then in terms of doing the sort of heavy lifting and the sort of partnership delivery element of ICTs, we have a community oversight board, which a number of our sort of key VCSE partners who are helping lead on the programme are represented on that board. So we just wanted to give you a flavour of how the VCSE is represented in terms of our local ICT development. Let's go to the next slide, Penny. So Paul introduced the core offer, ICT core offer that was developed last year. So we thought it'd be helpful just to talk about how, as we move to sort of a place-led approach, how in Brighton and Hove we're doing that. So this is a sort of a strategy on a page approach, which just identifies our sort of key local programmes this year that we're focusing on in Brighton and Hove. What I'd like to say about this sort of implementation plan was developed last year through a steering group. Some of you who work closely in Brighton and Hove will know that we put out expression of interest through Community Works for VCSE partners to join that steering group, with a bit of enabler funding to go with that. So the steering group worked last year, and they were the ones that really led and drove the development of this plan. So as was mentioned earlier, each of the 3 places have a front runner programme, which was an early test and learn model around integrated care strategy. For Brighton and Hove, that was multiple compound needs. If you haven't heard of multiple compound needs, it describes people in our local population who experience a number of sort of social and health needs around homelessness, substance dependency, mental health, contact with criminal justice service and domestic violence. So some of the most excluded and some people who experience the biggest health inequalities in our community. So it was what our health and care partnership decided would be our front runner programme. Last year we tested a multidisciplinary team approach and evaluated that approach. And this year we're moving from a test and learn into establishing that as our first integrated community team in the city, focusing on that sort of cohort who fit that sort of highest and ongoing care needs in the core offer. We're then focusing on to deliver the ambition of integrated community teams. We'll need strong ICT partnerships across the footprints. So we're really focusing this year on developing those local ICT partnerships in terms of building relationships, building an understanding of the work that each partnership does, understanding the local data that was collected and the community insights. And each of those partnerships are doing a pilot, which is a bit of a test and again, more test and learn, build those relationships about doing stuff together. So in the West, we're running a frailty pilot, and then in the East, a health hub pilot. So Brighton Hove, we have, if you know the city, mental health is one of our biggest challenges. Our health and care partnership identified this as an early part of what integrated community team development we wanted to focus on. So we're really leaning into the development of neighbourhood mental health teams that are being developed across Sussex with a focus obviously within Brighton Hove. Children and young people are a key part of ICT development. If you'll be familiar with the city, we have a number of family hubs that are sort of run by the local authority, where as a health and care partnership, we really want to lean into those family hubs and add value to the work of those through ICT development. And then lastly, around that whole population need, which is really where, as Joe was explaining, the community and voluntary sector can really add a lot of value. We have a programme called Healthy Communities. That's really about focusing on building on our existing health forums in the city to make sure the voice of our local population is heard. It's foundational to ICT development, and that actually through that, hearing that voice and working with our local ICT partnerships, we develop a local offer that sort of complements the core offer. So really reflects on the needs of those local communities within the footprints. So that's our key programs. So yeah, Penny, you're right to go on to a next slide. These are just some examples of the involvement and the leadership that the VCSE is already providing. So in our West area, we have this has already been established, but we have a number of health and wellbeing events, which are great examples of doing health and care differently, making it much more accessible, especially to communities where there are greater health inequalities. We're establishing that same model in the East as well, and we're really building on the learning of the community health inequality programme that ran last year and the formal evaluation that the community and voluntary sector drove, and that's really informing that whole population approach. And then just my last slide sets out how you can get involved and learn more. So we have an established health and social care network run by Community Works, so that if you're not involved in that, there's an opportunity to be involved in that network. I'll put the details down for our health forum leads. So if you're not involved in those health forums and you'd like to be, then please, yeah. And then a bit more information around some of the other programs. Just to note, we will be running an event shortly. We're probably, by sort of looking at the end of November, a stakeholder in-person event that really to sort of build on that implementation plan and really sort of promote that across all of our sort of local stakeholders. Right, that's everything from me, Paul.
Thank you, Chaz. So now I'm going to hand over to Vicky Smith. Vicky's the Programme Director of East Sussex Health and Care Transformation, and she's going to give us an update of developments in that area. So over to you, Vicky.
Lovely, thank you, Paul. Thank you for that introduction. I've got a similar joint role to Chaz in East Sussex. So these next slides will give you a flavour of our approach and how we've been making a start. If we can move on, Penny. Okay, so people will recognise East Sussex as a Shire county. This is the map of our 5 ICT footprints that we've got in East Sussex, which mirror our rural district and urban borough boundaries. As such, it's probably key to point out early on our voluntary actions, Hastings and Rother and 3VA covering Lewes, Eastbourne and Wealdon are as umbrella organisations, are key partners in helping us connect with over 3,500 plus voluntary community organisations that are out there in the 60 plus community networks and hubs that are active across our entire county. So we have that kind of relationship with key organisations, and of course significantly our East Sussex VCSE Alliance, which is a long-standing partner that we have that supports that leadership and a strong collective voice for the sector across that range of activity that the sector does. Next slide, please, Penny. So obviously our sector colleagues are a key partner in the delivery of integrated working across a range of things, whether that's through strategic planning, specific commission services, or the very local activity and support that's provided in communities. And as with Brighton and Hove, the voluntary sector is represented throughout our partnership governance down there on the right-hand side. In particular, light of the significance of the VCSE as a delivery partner in the ambition of ICTs, we've worked with our VCSE Alliance in East Sussex to agree how best to involve the sector right from the start of ICT development, through the sort of recognised approach that they have developed of generous leadership within the Alliance. So that said, we've got two key representatives from the Alliance on our East Sussex Community Oversight Board, which is the programme board for ICT development. And we've also agreed that we need to make sure that we're getting strong representation in our development sessions for ICTs. So we're having a voluntary action lead and a wider community network representative from that local footprint, and a representative from the VCSE Alliance to come in and ensure that voice of the range of contributions is captured in the initial development process. Next slide, please, Penny. And in terms of how we're taking that process forward, the early work this year has been about starting to lay the groundwork for our 5 ICTs through bringing together service and team leads in each of the footprints across primary care, community healthcare, mental health, social care for children and adults, also housing and other services in the district and borough councils and the voluntary community sector. So sort of start to introduce the concept really and begin to shape what ICTs can be all about, all the things you've heard earlier. We've also conducted a snapshot survey to understand a bit about our baseline position about how multidisciplinary team working happens across primary care and community-based services currently. And then going down to the bottom of the slide, looking at the blue and green boxes, what we've got at the moment is as a process of firming up some small tests of change, really, pilot work that's coming out of these early discussions and it's, you know, kind of other discussions as well, that we'll be looking to kind of get to grips with what that actually means in practice as we run up through to winter and into the next early part of next year as well. And we'll also be looking to develop a core group for each ICT and put some more formal arrangements in place around those gatherings as well. So that's the sort of next phase of work in the next few months. Next slide, please, Penny. So it's probably worth noting that we're building on strong foundations. I think people have said that already, just acknowledging that, not starting from scratch. So Penny, if you can just bring up the next slide to illustrate this. I mean, this is just a really short list. It captures some key initiatives that local partners are already collaborating on that speak squarely to the ambition for ICT delivery, and things like the PCN health and wellbeing coaches and social prescribers being employed by voluntary organisations, good neighbour schemes, family hubs, local hubs and one-stop shops. All of those things are actually quite integral to what we're trying to get to and strengthen how we do those things in local communities through the ambition of ICTs. Next slide, please, Penny. And also just to note that obviously we've been hearing these messages about some of the barriers that stop people from working together, like data sharing across partner organisations, lack of clear processes for decision making. These are the kind of things that we'd be wanting to actually tackle through the ICT development and get stronger and better at doing. Next slide, please, Penny. And so I suppose just to sort of sum up or try and gather in what the kind of key areas of focus are for the development work as we kind of move forward, or how we're understanding things really. You've got 3 areas. One is that sort of relationship and connectivity and that wider network of services and support. You've got your very focused work on multidisciplinary team working around the proactive care for complex needs. And also that whole area of how we jointly plan within each of those 5 ICT footprints to deploy resources, think about how we can do that better in relation to the needs those populations have. So our kind of centres for development are evolving around those kind of three key aspects really. And last few slides just in terms of finding out more information. So please do sign up to our East Sussex Health and Care newsletter if you haven't already. That will be a way we'll be absolutely filtering out updates constantly around all of this work. Next slide, Penny. In addition, some of you may be in a position to directly join the Sussex VCSE Alliance. If you're working across Sussex, but also it's got a wealth of information about what's happening with the sector in terms of leadership activity. So worth making contact with that as well, I think. And then last but not least, please, if you have any questions directly about East Sussex work and how you can fit in with that and what's happening, please do get in touch with Josh Broadway, who's our programme manager for Integrated Community Teams Development. He's very approachable and can help with a number of different things. So that's an open invitation. And that's my set of slides. Thank you.
Thank you, Vicky. Thank you. So now on to our final speaker. I'm going to hand over to Fozia Harrington. Fozia is the Director of Joint Commissioning and Integrated Community Team Development, and she's going to give us a West Sussex overview. So over to you, Fozia.
Thank you, Paul. Yes, and for those that, to put myself in context within Sussex, I have 2 counterparts in East and in Brighton and Hove. So Ashley Scarf and Tanya Brown Griffiths, who you all well know from East and Brighton and Hove. You may also know of my team, Liz Carter, who does a lot of work with the voluntary sector. So hopefully you are aware of her, and also Jean Lansamaki, who's our joint programme director, who leads on this. So just a little bit of context about me and how I fit with the rest of the team. Next slide, please. So just as a bit of context in terms of West Sussex, as always already been highlighted, we have our footprint for our ICTs is around our district and boroughs. So we've got 7 ICTs for Ada, Arran, Chichester, Crawley, Horsham, Mid Sussex and Worthing. We work with we have the One West Sussex Voluntary Sector Infrastructure Alliance, and that's made up of 4 infrastructure groups. So that's Community Works, Crawley, Community Action, and I've lost the other one. Arran and Chichester Voluntary Action, Mid Sussex. That's it. And we have. What's really critical in terms of how our voluntary sector are really part of this ICT development is through our 6 local community networks. Those 6 are aligned with the district and boroughs. So we have 1 LCN for Ada and Worthing, which is comes together as one. And we cover a population of about 850,000 people. So a little bit more about that local community network. Next slide, please. Thank you. So just in terms of how we're working with the voluntary sector, we are currently just reviewing in terms of some of our more strategic groups. So as with East and with Brighton and Hove, we have the Health and Wellbeing Board with voluntary sector engagement membership on that. We also have our Health and Care Partnership Exec Board and our West Sussex Community Oversight Group, which has the responsibility around the local development or the West Sussex development around ICTs. We are currently reviewing those terms of reference and that membership to see how we can to ensure that we've got voluntary sector engagement on that. It currently isn't. So we are currently doing that over the next couple of months to ensure that we've got that really embedded in our more strategic groups that are responsible for delivery. And we also have our West Sussex Mental Health Oversight Board, responsible specifically for the mental health element at place. So a little bit more about our local community networks. Our local community networks have been in place for a number of years now, started off with exactly the principle of what we're working towards in terms of ICTs, which is about bringing local assets, local services, and a recognition that we've got some really great services at borough level, and how do we ensure that they can work more effectively together and join up as a system at a local level. So it does bring together a range of health, local county council and the voluntary sector to do just that, which is a really great starting point for us in West. They are really key to us in terms of as our integrated community teams develop, how we work alongside them and with them in terms of that relationship and being part of that integrated community teams, which I will come on to. So the role for the voluntary sector, I see in terms of the LCN, is really to support that development of collaboration and relationships between all the services, so health and care and voluntary sector, and how we strengthen that. So next slide, please. So how are we developing ICTs in West Sussex? So as I mentioned, we've got our local community networks. They have been they select their own priorities. They know the population, they know the local population, and they work in terms of identifying local priorities. This year they've been using the really helpful ICT data packs. But also not just that, they bring their own insights, and they bring local data as well in terms of district and borough also hold some information, and they have quite a broad conversation in terms of what is it that we can do that can address some of these challenges that we're seeing through the data and through our insights. They are for this year just working through what those priorities are. So over the summer, they are working through those. So as an example, there are certainly, well, Crawley LCN has selected temporary, supporting those in temporary accommodation in terms of their health and well-being. So how do we wrap our services around those that are in temporary accommodation? We know where they live. We know they have challenges to face across health and housing and financial support and so how can we really wrap ourselves around them? That is also temporary accommodation also starting to come through in Ada and Worthing and in Chichester. Some of the other priorities that are coming through around older people, mental health, and what they're working through is and so what is it that we as a collective can do together that can really support those people. In the past, they've done some great projects around cancer screening, increasing the cancer screening, for example, and targeted lung health checks. So there are some very specific pieces of work that they've been able to really support and drive. So that's happening. That's one part of it. The other side to it is we are currently bringing together our primary care, so general practice, community, so and mental health providers in terms of the statutory organisations, in terms of recognising how can they work better together around those people with complex needs. So we're just starting during September and October time a piece of in terms of bringing them together to really to understand how do we strengthen those relationships. And what's coming clearly through is a recognition that there's many services, we've kind of lost some of those relationships between those services. So how do we get those back and strengthen them to make that seamless journey for the patient? So that is just developing in terms of and some great work coming out of that, which will really lead to some really good projects in terms of tests for change that we can build on. What the two in terms of that cohort, so from a really tight health perspective and the local community network piece, is around those two working together. So how do they identify priorities together and come together? So those conversations are just happening at this point in time as well. So the local community network, as I mentioned, has the voluntary sector on it, has health, county council, local district council on it. So collectively that becomes our very ICT neighbourhood focused team. We're also building on the work that Paul mentioned at the start around the Crawley as a front runner. So that front runner work has been going for 2 or 3 years now, and we have been fortunate enough to it's really forming some of the foundations of our thinking around ICTs in West Sussex. We've piloted some of that MDT working, and through that we're working more, and our next phase, and we've moved towards how do we develop MDT work, or multidisciplinary team working between Access Crawley, which is the point, the single point of access for services for Crawley Borough Council, like housing and financial advice, and West Sussex County Council, and so it's kind of bringing an MDT approach across quite in a different way. And again, the next step is around how do we bring a wider view around that. So I think it's quite an exciting time. We've got some things that they're all in development and early days, and we need to really ensure that we have voluntary sector at the heart of that. As Vicky has mentioned, in terms of some of the next steps for us as well, is around some of the formal arrangements around how we develop our ICTs. So we're working towards that for this year in terms of really bringing that together. Next slide. So this is just an example of how ICTs are developing in West Sussex. I think this was and building on what we already have. Probably worth mentioning on this, which I haven't mentioned, it's really important, is about the work that the LCNs are leading on in terms of asset-based community development, and that's recognizing that we really need to ensure that we understand the local assets that we have in each district and borough area, but it's not about a database of that. It's about ensuring that our health professionals are aware of those services and can make the connections. So we've been working with the district, with the county council, in terms of supporting them in ensuring that the local Clio database system is up to date and has as much local information about the assets in the area, in order that we roll that out across health professionals to ensure that they have access and understanding of what resources are out there that can support individuals. So that's a really important piece of work that the LCN is leading on. I think it's the next. So in terms of how to get involved, it will be primarily at this point through the local community networks, although I've mentioned we are reviewing some of our terms of reference for some of those strategic groups. But if you want to get involved, if you aren't already, do get in contact with Liz Carter, and she will be able to support you and in terms of understanding a little bit more how you can get involved, and to make the connections with any relevant LCNs that you might have. Thank you.
Thank you, Fozia. So we've come to the end of the webinar. So I'd like to thank all our speakers today, and most of all, I'd like to thank all of you who've made the time to attend. We'll be circulating the slides along with further details of how to get involved in the Alliance. This area of work is evolving fast, so watch this space, and we look forward to meeting with you again soon. So with that, we will say goodbye and bring this to a close.
Thank you, Paul.
Thank you.